For 1,300 hematologists, the morning started like this.
3, 2, 1, go!
I love to run, and it's especially great to run for such a good cause.
I'm very proud of being here to support the ASH Foundation.
A little bit of fun was sprinkled within major philanthropic efforts at the 10th annual ASH Foundation Run Walk.
It's our major philanthropic activity to support the foundation. The Foundation for the American Society of Hematology is the philanthropic arm of the society. We raise money to support research, to support young individuals who are trying to make a career in hematology, to support many of the initiatives that otherwise would have received no financial support. The greatest accomplishment this year has been to significantly increase the amount of money that we've raised for all the philanthropic activities that the Society does. We've got more membership that is involved in donating to the foundation. And in terms of this event, we sold out the 1,300 slots available to participate in the Run Walk already weeks ago, so we have a lot of people who are joining virtually and a lot of people who are joining in spirit. So in our 10th year, we've really made a big success with this major activity.
The Novartis-sponsored Ask2Escalate study is currently enrolling in the United States. Ask2Escalate is a phase 2 dose escalation trial of asciminib monotherapy for second and first line CML chronic phase. All patients will start treatment with asciminib 80 mg daily and can dose escalate if not meeting response milestones. The primary endpoint is major molecular response at 12 months in second line patients. Visit the Novartis booth 2429 for more information.
A highlight of the ASH annual meeting is always the plenary session, featuring the best of the best abstracts submitted. Dr. Dunbar, ASH Secretary, gave us an overview of this year's plenary abstract presentations.
Almost 8,000 abstracts submitted to the annual meeting this year. We had a lot of great work to choose from. For the plenary session, we strive to feature abstracts that are practice changing or paradigm shifting and that can be made accessible to a general audience of clinicians, scientists, specialists, and students. I think we fulfilled that goal this year. As a physician scientist myself, focused on hematopoiesis in my own lab, there was a lot to get excited about this year. In Abstract 5, we heard about deficiencies of a critical nutrient during pregnancy, specifically folate, and how it might impact on the lifelong function and health of marrow stem cells following delivery. So folate deficiency has got a lot of interest in terms of its impact on neural tube defects and other birth defects, but it hasn't been studied previously in terms of its impact on hematopoietic stem cells. Really profound changes can occur in hematopoietic stem cells that are folate deficient during pregnancy, affecting a premature aging phenotype in offspring, with potential impact on ability to tolerate chemotherapy, transplant, etc. Obviously, this needs to be confirmed in human epidemiologic studies, but I think most of us left the room thinking that, wow, better take those prenatal vitamins. There were several abstracts with great relevance to the treatment of sickle cell disease, spanning the globe, focusing on 2 oral therapies, one available for over 30 years, namely hydroxyurea, and another looking at potential promising new oral drug treatments. So US, Canadian, and African investigators provided a critical long-term update on results from the REACH trial, a prospective look at early treatment interventions with hydroxyurea in children with sickle cell disease in sub-Saharan Africa. Intensive monitoring was not required for safety, as we heard, and with up to 8 years of follow-up on hydroxyurea, they observed a remarkable decrease in vaso-occlusive crises, stroke, and other serious organ toxicity, as well as a more than 3-fold decrease in mortality. So this really brings out the point that effective therapy can and must be delivered to patients in low-resource countries. But hydroxyurea doesn't normalize life or prevent complications for all sickle cell disease patients. So it was incredibly exciting to hear preclinical data from scientists at Novartis in abstract number 2 They took a novel approach to identifying drugs that could turn on fetal hemoglobin via interaction with transcription factors. And they found a molecular glue, small molecule degrader, that interfered with a new transcription factor called WIZ that was able to turn on fetal hemoglobin in human erythroid cells from patients with sickle cell disease, as well as turn on hemoglobin F in a very potent way in a monkey model. So the movement of this oral WIZ degrader to the clinic will be eagerly awaited. And in terms of transplantation, there was a really interesting abstract about a new treatment for graft versus host disease. When I first considered going into hematology as a career, I wanted to do transplantation, but taking care of patients with severe chronic graft versus host disease that had very few options for improving their life was really intimidating to me. So I went into the laboratory and studied some other disorders. But this year there was real progress reported in the plenary session for treatment of severe transplant complications with graft versus host disease. Specifically in the AGAVE trial using axatizumab, an antibody that blocks the CSF1 receptor on macrophages. It's been shown that in chronic graft versus host disease, the interaction of CSF1 with its receptor is a driver in many of the complications that occur in terms of fibrosis and damage to tissues and organs. So the overall response rate was 74% in the optimized dose cohort, with durable responses in a majority. So this is really exciting news for patients undergoing transplant, especially as we begin to use more alternative donors. There were also a number of abstracts looking at new approaches to treatment in patients with blood cancers. The results of the phase 3 ISKIA multiple myeloma trial were reported out by a European consortium. They compared the addition of a directly cytotoxic anti-CD38 monoclonal antibody called isatuximab to standard triple induction and consolidation with carfilzomib, lenalidomide, and dexamethasone. They use the increasingly common primary endpoint of molecular minimal residual disease for the readout. There was a significant increase in MRD negativity seen in the patients that got the isatuximab. These results held up even in very high-risk myeloma patients. Finally, there was a very exciting translational abstract on the development of a strategy to treat malignancies with splicing factor mutations, namely myelodysplasia and chronic lymphocytic leukemia. Patients from Memorial Sloan Kettering Cancer Center used a highly novel approach to studying mutations in SF3B1, the most common mutation in splicing factors in myelodysplastic syndromes. And they identified a critical protein in the splicing machinery called GPATCH8 that was required for the splicing abnormalities occurring in patients with these SF3B1 mutations. They found that decreasing production of this protein via RNA inhibition could correct the defects in MDS cells, and we look forward to moving this forward to a specific therapy for these difficult to treat patients. I hope that many of you were there in person to hear these abstracts presented, but if you weren't, hopefully this summer will make you go read the abstracts and look forward to the exciting papers that are certain to come out of these in the near future.
Year after year, the ASH annual meeting offers unique sessions that focus on hot topics in the field of hematology. Sessions like this one on Sunday that addressed questions about maternal health, fertility preservation, and hematology care.
I hope the session really helped people understand the importance of the conversation, whether it's making time to have a conversation about fertility issues with a patient. It can be very hard when somebody's just been diagnosed with cancer, but I think Dr. Lauren and the other speakers made it clear how important it is to have those early discussions. And I think that Dr. Christensen's part about talking about how this affects physicians and trainees helps us know that as mentors, this is something that we have to think about, and maybe, don't be afraid to talk to our trainees about it and make them aware that that door is open if that's something that they have concerns about or want to talk to us about.
And the special session on race and science that explored how the concept of diversity, equity, and inclusion can be incorporated into trial design to ensure broadly generalizable results and therapies that are inclusive.
But we really need to start looking at the questions that we're asking in order to really accelerate discovery and to ensure that we are making sure that everyone gets the best access to quality care and treatments, but also that our research is asking the questions that are not based on inequities, that are not based on biases, and also those questions that are based on the last study, based on the prior study and the study before that. At some point, we've got to interrupt that to make sure that the implications from prior studies are not being carried over, that actually are really hurting particularly minoritized populations.
For those focused on quality improvement, this year's special symposium on quality highlighted several successful projects identifying and addressing underuse in hematologic care.
One of the topics today is on IVC filters, which are often placed to prevent a certain kind of blood clot, and they get placed very often, but they don't often get removed. Not getting removed can be associated with a lot of complications, and so this is one of the things we want to promote here. We're also going to be talking about underuse of a certain drug, hydroxyurea, for sickle cell disease, which is known to be very effective, but not always prescribed as much as it should be. And then finally, we're going to be talking about patient education for patients who are on anticoagulation, because they're prescribed very often, but patients aren't always given all of the education they need to use them optimally and know how to recognize potential issues.
Another quality-oriented session focused on guideline implementation champions, recognized by ASH for successfully putting guidelines into practice.
Studies have shown that it can take up to 17 years for groundbreaking research to be translated into successful clinical practice, and then to be written up in clinical guidelines, and then to be adopted in wider medical community. 17 years is a very long time. And so there is a big initiative and push to try and reduce that length of time by trying to speed up the process where clinical guidelines are written up and it's being implemented into clinical practice. We want to tell people ASH has been very successful in publishing the guidelines, but how are people implementing them? There's no point having a guideline if no one's using them.
Joint scientific committee sessions are also highly anticipated as they cover cross-cutting issues. From ontogeny and myeloid disorders of childhood to lymphomagenesis, the ASH annual meeting is where hematologists come to hear about the groundbreaking research that's moving the field forward.
Yeah, I think it's so cool to see a lot of speakers and also a lot of updates on new therapies and also guidelines. So I'm very excited to learn a bit more about that.
You learn about everything else, not only about your own field, but also when you are on service and you're on consult service, you need to see everything in hematology. I get to learn a lot, and I get up-to-date information on what's the latest. For example, there are some new drugs that I didn't even know that existed, and I'm like, wow, it's a good opportunity to catch up on all the advances in the field.
Earlier this week, we shared some of the impact of the ASH Minority Recruitment Initiative programs over the past 2 decades. ASH also hosts the Promoting Minorities in Hematology reception and sponsors the MRI Luncheon to provide minority hematologists and trainees with networking opportunities at the annual meeting.
Cool thing about the reception is there's so many different topics, so it's really spotlighting the amazing research that awardees have been able to do. People who are first and second year medical students to residents to junior faculty. And so regardless of what your clinical or scientific interest is, there's something for you. If you are a sickle cell researcher, or if you're a clinician in malignant hematology, if you do clotting disorders, there will be something there for you. I look around and I see how many underrepresented minority physicians and scientists we have been able to bring into our fold, helping people understand this is a career choice even as a medical student, when a lot of times people don't even know what hematology is as a medical student. So literally being able to give grants that help protect time for young researchers to be able to build a career. And I think the mentorship is key. You're surrounded by people who understand that sometimes pathways are a little bit different, and sometimes challenges for different people can threaten a career. So the Minority Recruitment Initiative puts all of us in the same room, in the same spaces, being able to celebrate each other, celebrate our diversity, celebrate our intersectionality, and it's just so impactful.
The Health Equity Collective was established in 2021 and since then has enabled more open discussion about the role of race in health disparities. The Health Equity Lunch offered another venue for important discussions that centered around the significance of representation.
It's really good to see the diverse, response of the audience. We have medical students, we have pharmaceutical, person, social worker, pediatricians and adults all bringing together, and this doesn't only extend to myeloma patients, it extends to all patients, underserved. Many institutions don't have that social worker or nurse navigator or a nurse that will help patients to help with medications, especially with the oral medications that we have now. As you saw in the case, lenalidomide was initially wanted to be added, but because the copay was very high. And if you had a social worker, we can apply for grant because there are resources out there to help patients whose copay, and we see that across the spectrum, that copay can be very high. And we have in more and more oral, chemotherapy, that we are going to have more high copays. And so having someone, a social worker, a nurse navigator, to help patients with grants, and we, in many centers have it, but there are some centers that don't, and this is a big issue, and we have to address that.
The Ham Wasserman Lecture is also a highly anticipated and well-attended session.
A great honor to give the Ham Wasserman Lecture 2023, and I spoke about a 35 years long journey unraveling the pathogenesis of PF4-mediated platelet activating disorders. We started to learn about it 50 years ago. In the pandemic, we learned that anti-PF4 antibodies can cause the adverse vaccination effect VIT, which came to a big surprise to all of us. Now we understand that anti-PF4 antibodies are a new, until non-recognized cause of severe recurrent thrombotic complications, and it will be the work for the next years to unravel the role of these antibodies for patients with recurrent stroke and recurrent pulmonary embolism.
How can we provide sustainable care for hematology patients? That question and others were answered during the ASH Clinicians in Practice Lunch. ASH News TV spoke with Chair of the ASH Committee on Practice, Dr. Chancellor Donald, who shared key takeaways from this discussion.
We were blessed to have a wonderful panel of 4 really talented physicians that talked about sustainability of care, delivering high quality care that improves the well-being of the patients that we serve. We were really pleased to have this discussion and had great feedback from the audience. When we talk about sustainability, we're talking about improving the quality of life of the patients that we serve, as well as ensuring that the overall well-being of that patient is preserved as well. There are multiple ways to achieve this, pathways to help dictate treatment using artificial intelligence and clinical pathway tools, as well as associated financial toxicity that can occur in the delivery of hematologic care.
ASH's prestigious honorific awards recognize hematologists who have made significant contributions to the field of hematology. This year's recipients include Dr. Stephen Sallin and Dr. Helen Heslop, who received the ASH Mentor Award for their mentorship from bench to bedside and beyond. Dr. Alexis Thompson received the ASH Award for Leadership in Promoting Diversity for championing diversity across the healthcare continuum. And Dr. Blanche P. Alter received the Wallace H. Coulter Award for Lifetime Achievement in Hematology for her 50 years of dedication and innovation as a physician scientist. In addition, don't miss the presentations of the Henry M. Stratton Medal and William Domashek Prize on Tuesday morning. Congratulations to all of the 2023 honorific award recipients.
A powerful annual collaboration continues at the ASH annual meeting, the ASH EHA Joint Symposium. This year's joint program focused on stem cell transcriptomics in the niche.
This session is talking about the important role of the microenvironment we call niche, how they regulate the stem cell at the different stages. My talk focuses on second stage, that's in the fetal liver, how stem cell being expanded. But different from previous people think that's fetal livers always support stem cell expansion and proliferation. We found there are two niches. One niche, Portovin can maintain stem cell, but another niche promotes stem cell proliferation.
That does it for us on another edition of ASH News TV. We hope you continue to join us as we cover the last day of the 65th ASH Annual Meeting and Exposition.
Tipsovo, ivosidenib tablets, is a once-daily oral therapy for the treatment of adult patients with acute myeloid leukemia, or AML, who have a susceptible IDH1 mutation. Patients treated with Tipsovo have experienced symptoms of differentiation syndrome, which can be fatal. QTc interval prolongation and Guillain-Barré syndrome can also develop in patients treated with Tipsovo. Please review all important safety information below and see full prescribing information, including boxed warning for AML patients at tipsovopro.com/AML. For newly diagnosed patients with AML who are ineligible for induction chemotherapy, Tipsovo delivers a laser-focused solution. Tipsovo plus azacitidine delivers 24 months median overall survival versus 7.9 months with azacitidine alone. That's a threefold improvement over azacitidine alone and a 56% reduction in the risk of death. Tipsovo, laser-focused on survival.